Ever get that itch? Like, what's really going on with this medical stuff? Today we're going deep, and I mean deep, on something most folks probably don't think twice about until they need it. Red blood cell transfusions.
Right. It's almost like a hidden world, you know, and we're looking at a huge change globally even in how doctors are handling these transfusions. Not the old more the better, but something way more, I don't know, careful.
Okay, so back up a sec for me. We're digging into excerpts, right, from two big medical journals, like the stuff doctors actually use to decide on guidelines and all. But before you panic, we've already chewed through the jargon so you don't have to.
Yeah, no need to pull out the medical dictionaries for this one. We got you.
So the big takeaway for someone like me who's heard of transfusions but couldn't explain them to save my life.
Think about this. Millions of red blood cell transfusions every year around the world. But what most people don't realize is there's risk involved. Every single unit of those cells, there's a chance of complications. And some can be really serious.
Hold on. So not just like getting, what, an IV drip of saline solution? This isn't nothing then.
Nope, not nothing. And that's where you get this restrictive strategy everyone's talking about. Both these sources, they hammer that home.
Okay, so restrictive means being stingy with the blood.
Kind of. It means being way more careful about when a transfusion is really necessary. Like, is it actually needed, or are we just doing it out of habit? Big change in
And
thinking.
it's all based on this new research about hemoglobin levels.
Right, you got it. See, hemoglobin, that's the stuff in our blood that carries oxygen.
Yeah, keeps us going.
Exactly. So for ages, higher hemoglobin, everyone thought, ooh, that's got to be better, right? Turns out, not so fast.
So we don't need as high a level as we thought. Is that what you're saying?
Yeah, that's the thing. Turns out, for a lot of patients, a lower level doesn't mean worse outcomes.
And that is where that magic number comes in, the one I kept seeing everywhere. 7 Gre DL.
Bingo. Both these sources, they land on 7 Gre DL. That's the new target, the threshold, before transfusion's even on the table. For many cases, of course.
Which, I gotta say, way lower than I'd have guessed.
Right. Big change.
It's like they're trying to make that number as common as, like, knowing your blood pressure should be 120/80 or whatever.
Exactly. Imagine if everyone knew 7 Gre DL was the thing to watch. That's the impact these guidelines are going for.
Okay, but, BUT, before folks start thinking this is simple, there's got to be exceptions, right? Like, this isn't one size fits all, is it?
Oh, you are so right. Age is huge E.
Yeah.
Kids. Totally different guidelines, heart conditions, different story. It's like way more complicated than you'd think.
One of these articles, I swear it even said the type of surgery you had changes things. Like orthopedic is different from heart surgery.
You're catching on. The body reacts so differently depending on what's going on,
Mm.
you know? And that's why informed consent is absolutely crucial.
Okay, so before we get into all the less than fun stuff that can happen with a bad reaction, what does that even mean? Informed consent, beyond just signing on the dotted line.
It means you got to have that real, honest conversation with your doctor, benefits, risks, the whole 9 yards. I got to lay it all out, even the rare
Yeah.
stuff.
Because it's not just a walk in the park, these transfusions.
Exactly. You got to be in the loop, know what you're getting into.
Yeah.
That's what informed consent is really about.
Makes a lot more sense now, that's for sure.
It's about having all the cards on the table so you can make the best choice for you.
Right. Absolutely. Especially when it comes to something as potentially complex as this. All right, so we've covered the risks, this restrictive idea, that 7 Gre DL target. But what actually happens if someone has a bad reaction? You said, like, anything from annoying to life-threatening? What are we talking about here, really?
Well, it really runs the gamut, which is why one of these sources, it actually breaks down all the possibilities.
Oh, fun.
Yeah, not exactly light reading, but important stuff. So on the mild end, you got your fever, chills, maybe a rash, stuff like that.
So no, just like a quick nap and you're good to go.
Not quite. But then you get into things like allergic reactions. Those can be much more serious, obviously. And then in rare cases, you're talking about circulatory overload or even this thing called hyperhemolysis.
Oh, okay, yeah, those don't sound good at all. See, this is what I mean. You just don't think about this stuff. I hear blood transfusion, I figure it's routine, but there's a lot more to it.
Way more than meets the eye. And one thing that really jumped out at me in both these sources was this emphasis on delayed reactions.
Delayed. You mean like you don't know something's wrong till days later, weeks even?
That's exactly it. Some reactions, they happen within 24 hours, no problem. But others could be weeks before anything shows up. And that's why knowing this stuff is so important. If you know what to watch out for, even later on, you can advocate for yourself or for a loved one, right?
It's like having this insider knowledge that most people don't about how to navigate the whole healthcare system.
Exactly. You're not just going in blind, you're empowered.
Mm.
At least that's the goal.
Right, which is kind of the whole point of these deep dives, right? Arming people with information.
100%.
Mhm.
It's about giving you the tools to be an active participant in your own health decisions. No one can replace that doctor-patient relationship, but
But you got to be able to hold up your end of the conversation, right?
exactly. Okay, so someone's facing a situation where transfusion is on the table. We've got these guidelines, the 7-GBL thing,
Yeah.
but we also know it's not that simple. What's the key message for someone trying to figure this out with their doctor?
Yeah, good question.
It boils down to communication. Can't stress that enough. Talk to your doctor.
Hmm.
These guidelines, they're a starting point, but everyone's different.
Right. So no clinging to that 7-GDL number for dear life.
Right. What are your symptoms, other conditions? What do you actually want? All that matters.
It's that whole holistic thing again, isn't it?
Bingo. Both sources make that clear. It's not just numbers, it's the whole picture. Blindly following a number could do more harm than good.
Which makes sense, right? Doctors, they're the experts, but
Yeah,
you got to be your own advocate too.
100%. And this is where it gets really interesting, because if we're being so careful about using blood, it makes you wonder what else is out there. To treat anemia, I mean, if they're trying to avoid transfusions,
Dude, you're reading my mind. I was just thinking that.
right, it's like this whole thing is pushing us to think differently. If we're conserving blood so much, what does that say about the need for other options?
See, and that's where it gets really interesting to me.
It does, doesn't it? Like it opens up a whole new can of worms.
Totally, because if we're saying, hey, fewer transfusions, it's like, what else you got? What's the alternative?
Right. And these articles, they kind of hint at that. It's like this whole shift is shining a light on, hey, we need more research into other options.
So we're talking like ways to deal with anemia that don't involve transfusions at all.
Exactly.
What, like sci-fi blood substitutes or something?
Well, maybe not sci-fi, but definitely on the cutting edge. Like there's
Yeah.
some really cool stuff happening. Scientists are looking into how to like make the body produce more blood on its own, stimulate it somehow.
So instead of getting it from someone else, you just like tell your body to make more.
Basically.
That is wild.
Yeah. Yeah. And it gets even wilder. There's this whole other area of research, artificial blood substitutes, like things that could, theoretically, carry oxygen, just like the real deal.
Okay, now that sounds like it's straight out of a movie.
Right. But it's a real thing. And the potential is huge. Think about it. No more donor shortages, no more worrying about reactions. You've just got this, like, safe, effective alternative.
That would be, I mean, that would be revolutionary.
Totally. It's like we're on the verge of some massive breakthroughs here.
Absolutely. This whole conversation has given me a whole new perspective, I guess.
Yeah.
Things I just never thought about.
It's amazing what you find when you start digging into this stuff.
No kidding. So as we wrap this up, for someone listening who might be facing that decision about a transfusion someday, what's the one thing they should take away from all this?
Honestly,
Yeah.
don't be afraid to ask questions. These guidelines, they're a starting point, but every single person is different. Talk to your doctor, make sure you understand what's going on, and don't be afraid to speak up for yourself.
Be your own advocate, right?
100%. Knowledge is power, especially when it comes to your health.
Couldn't agree more. Well, folks, that's a wrap on red blood cell transfusions. Hopefully you learned something new or at least started thinking about it a little differently. We'll catch you next time for another deep dive into, well, you'll have to wait and see.